welcome to the Mental Health Hour. This is episode 42, Preparing for Surgery. Today we're doing a special Tuesday edition of the Mental Health Hour, and we will be talking with Gemma again as we continue her journey. Since episode 5, we've been learning about Gemma and all of her diagnoses and what have you, and we're going into surgery tomorrow. But first, let's take a moment to welcome everybody in. Hello, Hattie. Hello, Tracy. Hello, everybody. Hello to all the live viewers that are coming on in, and hello to our replay viewers as well. We appreciate everybody that comes through and stops in and says hello. We had a little bit of a time issue tonight. We'll get it right. So the first time we had daylight savings time, Gemma, you switched your clocks first, right?
Yeah, we went a couple of weeks before you.
And then now this time we switched our clocks before you.
Yeah.
So I was
So
literally
a couple of weeks, yeah.
ready to broadcast, and I'm like, where the hell is Gemma?
And it's when you rang, and then I'm like, what are you on about? I've got another hour yet. Like, no. And then it dawned on me, I'm like, oh my gosh, you've altered your clocks, haven't you?
Yeah. So
I didn't even twig. Oh, whoops.
It is good to see everybody in here, and I am very happy to
put this somewhere that I can reach it.
Be here on a Tuesday night. So Gemma, let's get right on into it. This week's episode is all about prepping for surgery and that mental space, that mental feeling that you get when you're heading into a surgery. My wife is getting ready for a C-section, of course, with the baby coming on May 3rd. So she's going nuts, and there's all kinds of things flying around, thoughts, racing thoughts, everything of that nature. So what's going on with Gemma today, preparing for surgery?
I'm kind of glad we're doing this because it's giving me something to focus on. Even though I'm discussing it, not thinking about it. I mean, I've looked up some stuff to share with you, and I'm like looking at stuff, and I'm like, oh my God, I shouldn't have looked this up. Seeing stuff, but then I know what to expect. It's just I've waited so long for it. They called me earlier and told, I saw a hospital number, and I'm like, oh no, because I've been waiting over 2.5 years for this surgery, and I was originally referred for potential surgery 7 years ago, but when they mentioned surgery, I'm like, nope, not happening. I want to try other things first. So I have exhausted all other options now. But oh God. And so yeah, I've been waiting 2.5 years for this, and it's been cancelled twice due to COVID. And I'm trying to compose myself with your comment. Oh dear.
So how long? Let's bring it back in. How long have you been dealing with or waiting for this surgery? I guess is the.
So I've had what I've got is called intestinal paralysis. It's also known as let me look up the app. It is exactly known as something else. I'm just looking up the medical term again. Bear with me. I've got it here. So it is the ileus, so paralytic ileus, and it means that sometimes it's just your small colon, your small intestine. Sometimes it's your large, but it's my entire intestines, and it's all paralyzed. It started off being my small, then it went and moved on, and now nothing works. It's just dead. So it means that whereas your intestines would contract to literally move things along, mine don't do that. And in turn, it started in the bladder, and I had mild bladder paralysis, where I'm not getting your brain controls everything in your body, and it sends a message from your brain to like the bladder to the bowels and back, like when you need to go to the toilet, when you need to do things. And that message isn't going, it's not doing anything.
Firing.
Yeah. So because of that, I was originally referred, it was about 7.5 years ago, having problems with that. I had what's known as a suprapubic catheter inserted about 2.5 years ago because of the bladder paralysis. And I was referred for this surgery 2.5 years ago. I had the trial phase because this particular surgery has to come in 2 stages. The trial phase to check that it's going to work, because they don't want to start implanting stuff in you if it's not going to do anything. But also the cost of it. Now over here, most healthcare is deemed as free on the NHS. However, this one is not funded by the NHS. It's privately funded. Now, if you are an NHS patient, it's not costing me anything. However, they have to apply for funding, which means I don't know whether it's every month or every 2 months or whatever, they put your case to a board, like a panel, and they literally, your life is in the hands of other people that don't know you. They don't find out your name or anything, but they give like information. So they would say, for example, that I'm female, 38 years old, single mom, got this, and this wrong with me. They've tried this, and this, medication, what I'm on. And then they will maybe see my x-rays, things like that, and say, okay, are we going to fund this or are we not? The cost of the surgery that I'm about to receive is £25,000, which is about, I think, $32,000.
Yeah.
It's a slightly more because of the device that they've let me have. Because of my age, they have allowed me to have a recharge unit, which means that instead of having to have surgery every 3 to 5 years to change the battery, it means that it should last 15 years. This device hasn't been out long enough to know it lasts 15 years.
Right.
I'm going to be one of the few, like, it's been out a little while, but not 15 years. So they don't know how long this battery will last. I'm just going to share some slides, if that's all right, just to show what I'm going to have. And then I've got a video to explain as well. Like, bear with me. So this here. Okay, so this seems to show it at the front, but it's not. Like, this electrical stimulator is going to be just above my bum cheek, and it connects to the sacral nerve, and it allows the brain to retransmit the messages back and forth, and causes, like, if anyone's ever used a TENS machine for
it
pain. Feels just like that, but inside it's quite an unusual sensation. Now, depending on how high you have to have it to get the result that you need will depend on how much you can feel it. Now, I remember having it on fairly high, but it was about 3/4 of the way up. Now, I'm just gonna show, like, where have I got it here? Oh, I don't think I've uploaded one that I needed to. Just bear with me. I have got one particular one.
So while all this is going on, where's your headspace at? Like, how are you feeling?
I'll be relieved when I can have it done. Forget it. But at the same time, like right now, I'm feeling quite sick with worry. Like my head's like, because I know that I've had bad reactions to anesthetics and stuff.
Mm-hmm.
I'm like, part of me is worrying about, am I going to wake up? Is the anesthetic going to make me ill? Am I going to feel this thing? Because whilst I've had the trial of it, the only thing that was implanted during trial was the very end of the sacral nerve stimulators, which are 2 little prongs. However, this time I'm going to have the whole wire. I'm going to have the battery and the transmitter, the internal transmitter inside me. And then on the outside, obviously there's the controller, there's a recharge unit, which is like worn on a belt once a week, I believe. It is actually pretty much the same as a pacemaker. They do say it's very much like a pacemaker, because this will determine like the way it works. Basically, it's to control it working. You can control it. It's literally a Samsung phone they give you. I'm gonna put a little video up just to show you, like, see if I can remember which one's which. Okay, so this one is about the device. Let me just show you. Okay, Medtronic is the people at going to remove that. That's just about the guarantee and stuff. But anyway, yeah, Medtronic is so regarding my anxiety, they haven't given me anything as yet, but they probably will tomorrow. They're going to give me something via IV for my sickness because anesthetic makes me very, very sick. And I think there was once when I really struggled to come round from the anesthetic. So they are prepared, knowing that I'm an anesthetic risk. But it's literally the one that you saw there, the one that he had like that's the battery I'm going for, the recharge one. So it's literally like a USB pen drive. It's really, really quite small. And it gives you up to 15 years without having to have any more surgery to replace that battery, which is what I thought. Even though, like, I have to remember to charge it every week, it's like thinking about how many times that's going to save me having to be come to have the battery replaced. Because they say the recharge-free unit is 3 to 5 years. So even if I do get 5 years out of it, that's at least 2 or 3 surgeries it's going to save me. And then it might last more than 15 years. They just don't know, but they say that they guarantee that it'll last 15 plus years. So I don't know. But
so, you know me, Heavenly Dew in the house. Hello.
Hey.
And hello to Eric J Gaming. Uh, very good episode with him last week. Please
Mhm,
watch a replay on that with anxiety. Um, Michael Joseph Murray, good to see you. Hattie, everybody. Shirley, I love my Shirley. Great to see everybody here tonight. And
mhm,
we're talking about Gemma is getting ready to go for surgery tomorrow.
mhm.
So there will be no mental health hour tomorrow. We're doing it tonight, special edition, Tuesday night prior to the surgery. Um,
Mhm.
so she is going. This surgery has been on the books for a while. Um,
Yeah, 2.5 years I was
yeah,
with.
and very necessary. This is one of those things where COVID-19 has come into play again and halted process on essential surgeries and essential medical services and everything
Mhm,
that comes excuse me with it. um I just we Gemma and I got to talking uh last week, and I like to turn everything into an episode.
mhm,
um
mhm.
this is a perfect example, or a perfect episode for just a check-in mental health type thing. A
Mhm,
lot of people go for surgery, right?
mhm.
A lot of people have to deal with whether it be, and you know what? Surgery is surgery no matter what you're getting surgery on.
Yeah.
It's scary stuff no matter what part of the body it is. Nobody wants to go under the knife,
Oh,
even if
no.
it's your, uh, I don't know, big toe or something. Like
It's scary for anyone, no matter what
that.
it is. Mhm.
Welcome, everybody. Hey, Trevor. Good to see you. Um,
I was saying to someone the other day, like, no matter what pain you're in, if it's physical pain, nobody can take that away from you. Nobody can invalidate that because at the end of the day, like I said, if you've, for example, got a broken leg and there's someone down the road that's got two broken legs, they can't say to you, well, mine's worse, because at the end of the day, you've only ever known that one broken leg.
mhm,
Whereas, okay, yeah, they've got two, but for you, that one broken leg is painful, it hurts. So that's your pain. So nobody can take that away from you, no matter what it is.
exactly.
And okay, somebody might have been through something completely different, but that's their pain. They feel that, not you, and you feel yours. So it doesn't make what you're going through any less valid or any less important. It's the same for anybody, no matter what they're having. If it's surgery, if it's anything, it's just as important for that person to deal with. And it can be really, really worrying.
Yeah.
Like,
So
oh, like, mm,
it's a good topic to discuss tonight, uh,
mhm,
as we do a special episode for you guys here on a Tuesday night before Gemma's surgery. Um, surgery in itself is a scary thing. And just like Gemma was saying, it could be yourself or a loved one. Uh,
mhm,
Somebody's prepping for surgery. Somebody is getting ready to go under the knife. They're scared. My
mhm,
wife is very scared right now about the C-section. She's done this before twice, but she is
mhm,
still scared. And we got to be there. I have to be there for her, supporting and letting her know everything's going to be okay.
mhm.
While they do these surgeries all the time, um, like literally, there's surgery happening right now somewhere in the
Mhm,
world. There's surgery happening. Um, we have crafted and we've become pretty good at this medically, um, and that's incredible. But it's still a very scary thing. and they always tell you, you know, it doesn't matter what kind of surgery it is, it's still risky. Every
Mhm.
surgery has risks.
Oh,
Uh,
yeah.
so, in talking about this, and Gemma was like telling me, um, you know, I'm not going to be able to do the show on Wednesday. We're going to have to do it on Tuesday because I got to get the surgery on Wednesday. Yeah, that's fine. Why don't we turn this into an episode and, you know, check in with ourselves and with uh, everybody we know that might be going in for surgery? Kind of give them a little hello, how are you?
Mhm.
And that's what we're doing with Gemma tonight. So, I mean, I've asked you already what's your headspace like, but like, give us a real uh, honest
The real
100%.
unfiltered version.
Yeah, give us the down and dirty. How do you feel right now? What are you doing to help? And you know there's anxiety there, right? You
Oh,
know.
yeah, yeah.
So,
Honestly, I'm absolutely terrified. I'm terrified that I will go to sleep and not wake up. I'm terrified that I'm gonna end up something's gonna go wrong, or that it's not gonna work, or I'm gonna get an infection. I've had problems with surgery before. They've given me all the MRSA decontamination stuff that you have to wash with and nasal stuff, and it's
mhm.
disgusting, and it's made my hair all nasty and stuff. But yeah, I'm absolutely terrified, and I won't because it's been cancelled twice before as well. Like until I'm there with the needle in my arm, I'm like I won't allow myself to think too much about it because, like last time, it was cancelled the day before. They rang me at like just before 6 o'clock and said, "We're so sorry, we're going to have to cancel your surgery." Again, it was due to COVID. It was the doctor's daughter, I believe, had got COVID, but it's got like there's just so many thoughts that go through your head, and even though I know that I'm probably going to be fine and stuff, it's it does worry me. And as they've said, like it was about 7 years ago I was initially put forward for this surgery, but the first doctor wouldn't touch me because of my spine. He says my spine's not in very good condition, and there is a very small chance that if they hit the wrong spot with your spine, it can paralyze you from that point down. And that is also another worry for me
Mm,
that that will happen
right.
because obviously until you wake up, you don't know what's happened.
Yeah. Yeah,
Um,
and as Heavenly Do said, no negative thoughts, you know? Like,
yeah.
you gotta go in there with that can-do attitude,
Mhm.
and, they do this all the time, and we're gonna get through this, and, uh, was nice enough to let everybody know he'll update everybody on Gemma's Discord as soon as he hears from you. You're gonna
Yeah.
keep everybody posted, um,
Mhm.
uh
Yeah, I won't be able to do it myself till probably much later on, but I will message like yourself and whoever to let them know.
yeah.
Um, just to keep it going so that you know I'm all right. I do have a little video on what's gonna happen. Like there are other when I was looking, there are other ones, but obviously we don't want anything graphic.
Right.
Regarding the blood clots, I actually did have DVT in my leg quite a few years ago. I had surgery on my leg, and I ended up having to have the injections in my stomach
Mhm.
for best part of 2 months, and it was fine. Thankfully, I didn't have to have any surgery. It did actually seem to rectify itself, but I had to have the stomach. Ugh, painful, constantly having to inject yourself. Um, but I had to have them as well when I'd had surgery on my legs because I wasn't as mobile a few times. But I'll just show you a little um,
Sure.
video on It just explains what it is, because this is, I've had the trial phase, so when it refers to the implant phase, here we go.
Because the evaluation phase was successful, you may be eligible to receive a permanent sacral neuromodulation or SNM system. There are different versions of the system, and you may have already decided which one is right for you. Together with your clinical team, you will discuss the available options. Whichever option you choose, the permanent SNM system consists of 2 components, 1 lead and 1 battery. These are implanted under the skin. You will also be provided with a controller, which looks like a smartphone, and a communicator. You will use these together to manage and adjust your therapy. If you receive a rechargeable system, you will also be provided with a battery recharger, its docking station, and a belt for your recharger. Now, let's turn our attention to how the system is implanted. What can you expect with the implant procedure? During the procedure, you will be lying on your front. Some cushioning will be used to make sure you are comfortable. Your lead, a thin wire, is inserted in your lower back and positioned near the sacral nerves in your pelvic floor. The battery is the part of the system that produces the pulses of stimulation and also goes under the surface of the skin in its own little pocket in the upper buttock, where it will be most comfortable and cosmetically acceptable for you. This minimally invasive procedure may take an hour and can be done under local or general anesthesia. This will be decided with your clinical team. After the procedure, you may feel a bit sore, but this is quite normal, and you will begin to feel more comfortable in the days that follow. Either on the day of your procedure or a few days afterwards, someone from your clinical team will program your device to reproduce something like what you experienced during the evaluation phase. After your device has been programmed, it will normally run continuously for 24 hours a day. For a period of 6 weeks, or whatever your clinical team have advised,
I don't know if it answered it in there. I had to go shut the hamster up again. But he bit me as well, so I need to go get a plaster. But the surgery will take about an hour, they said. But it's, where am I? I've shown that one.
So not only do we get a couple of things out of this, mental health wise. We get to check in with how we prep for surgery. And then we also get the after effects. We'll check in with you, obviously, as you progress. And you'll be good to do the show next week, as we were talking about.
Oh, yeah.
We're not gonna. I don't know if we'll do a show post-op or whatever, but anywho, either way, we'll be able to get the mental health side of going in and coming out of, it's kind of cool to see and feel, and then when you go through something, it doesn't even have to be surgery, right, Gemma? Like you can any goal you have set or whatever, or a hard task that you need to complete, leading up to it, you got the butterflies.
Oh yeah, anything.
You got the scared feelings. You check in with yourself. You feeling, I don't know, and then when you get on the other side after the task is completed, you get that elation, that feeling of completion, that feeling of everything is great. So we'll talk about that more next week. We'll have not a special episode. We'll have a episode planned out for next week, we'll tap in and talk a little bit about this in the beginning, if that's all right with you, Gemma.
Yeah,
But,
fine.
moving forward, tomorrow. So we've already kind of talked a little bit about what surgery you're having, and we've talked a little bit about where your headspace is. Can you tell us anything more about, what this will help, what this will accomplish?
Yeah, let me just put this on to explain like why then. So this is what I have. Okay. So because it says like the ileus and stuff, and it can cause many things. So I've already had the appendicitis and I've had it removed. It can cause other things with other problems. Like I've had intestinal problems. I've had and still going through kidney problems now. I've got the thyroid problems. Mine's underactive, which is unusual apparently for this, but I'm just an unusual kind of person, it seems. I've got all the low level minerals and things. I'm on multiple medications to try and control that. But it's to try and stop other problems because it's like it apparently can cause, like it says, cystic fibrosis, other lung problems, stomach problems. I've got because I'm not getting rid of waste like I should. I have on a few occasions ended up in hospital with what was it called? Toxic shock. Because I've been storing waste that I should get rid of from my body, and I can't. Oh, that hamster! I can't get rid of things, so I've been taking medication to help with that. But because it wasn't, I ended up with fetal impaction, and then I collapsed with toxic shock syndrome and had a convulsion, which has happened 2 or 3 occasions now.
Yeah.
And the real thing for me when I really realized, you know what, I'm going to have to do something about this, was when I'd collapsed and Thomas saw me. And I have a fall detector in the house because I'm prone to falling anyway. But he knows that there's an emergency button. If I can't press it and he's about, it does detect when I fall, but it's not 100% accurate. And he pressed it and he said to the operator that answered, I think my mummy's dead. And I was just coming round and I overheard that. And I thought to myself, right now, I need to get something done about this. Now, unfortunately, COVID has had it cancelled twice, delayed massively. I literally had a date booked, then COVID hit, and then that was cancelled, and it was just delayed and delayed. But I can understand with the depression and stuff because it's like adjusting to the new life again. Like I've been told for at least 6 weeks I shouldn't be lifting, bending, stretching, or anything like that. And I mean, I'm not massively active anyway because of my like disability and stuff anyway. But for somebody that is normally very active, they could probably find that quite difficult to go from a potentially active lifestyle to nothing. Having to rest up, having to take time off doing maybe work or other things. So it's trying to adjust to the new lifestyle, but at the same time move forward with the new one and come to terms with that. And even though it's not going to massively impact my physical ability, it will still slow me down for quite a while. And I need to try and invest in a decent donut cushion so that I can put it round because I'm concerned about laying on it and things. And that's one of the things that worries me, that I'm going to be able to feel it under the skin maybe, or that you're going to see it and things like that. I've got something here as well that I found. Now, there's just this again, which is a lot of the things I've had. Obviously, like the baby one doesn't really affect me. It wasn't something that I had from birth, but it is potentially a knock-on of effect of conditions that I've had since birth. But as it's like I've had the gallstones and everything, it has affected that, but it's now gone from what was a partially paralyzed to full, as it's just got worse. I'm on the medications. I've had the abdominal surgery already to try and help. And one of the things that I've had to do, just to explain, is here. I have a tube that goes from my stomach, and it's literally that, and it comes through my bladder, and it's like having only way to describe it is like having a permanent piercing, but through your stomach. And this is hopefully something that, if it really works well, that I'll be able to have removed. However, because I've had a permanent drain on my bladder for over 2.5 years, that's going to take some building up. So I'm going to have to build bladder tone back up. Now, I know that when I had the trial phase of this and I tried it, like, obviously it's embarrassing to say, but I did actually wet myself significantly. And it's not pleasant, but eventually building the bladder tone up might mean that I can have it removed. But I need to go shut that hamster up, but the little shit bit me, so I don't want to go and grab it again.
So, if anybody has any questions at all for Gemma during this process of her surgery, please feel free to drop them in the chat. Thank you guys also for the bits, the subs, the likes, the follows, the shares, everything. It is very much appreciated. Everything goes right back into the show, as we tell you every week. And I also wanted to point out a good comment by Heavenly Dew. I love when shit like that works out. You know, even your hoodie says "just strong."
Oh yeah.
Just keep repeating that, and you know, things like that aren't planned, and that people catch. I love things like that. So just wanted to throw that out there.
I didn't even notice.
But it's awesome. It really does. You know.
Well, answer Eric. So the battery is to power it, because it's effectively like an internal TENS machine, or they like compare it to like a what Michael said earlier, like a pacemaker, and the battery is to power it. Otherwise, it wouldn't be able to, because it sends an electrical pulse constantly to the sacral nerve to stimulate it, because as it is now, it's just dead, it's not working. So by doing that, powering it with the battery, it's causing it to work again and to cause the contractions and things that it needs to keep moving, and sends the message back and forth as it needs to do. So that's the battery part. And then with the surgery changing, it will allow it'll allow things to work. I have actually had a lower organ prolapse, which they've got to sort at a later date, but this one at the moment is the more important one, because I'm effectively poisoning my own blood. I'm on tablets to stop. I'm on antibiotics a lot, just to stop me giving myself sepsis because of the fact that I can't rid myself of the waste. So it will effectively allow me to go to the toilet, getting down to the bottom of things, literally. Go to the toilet. Hopefully I'll be able to have my catheter removed in time, but it will mean that I can hopefully come off some of the medication as well, because when my body starts working normally, I won't be poisoning myself, and hopefully get well, because I don't know if you've ever, like, probably a really rank subject, but if you've ever not been regular at going to the toilet, and when you start to feel really bloated and stomach cramps, things like that, or if you've ever had to have laxatives to help you go, it's not pleasant for that one time. But if you can imagine going months and months without going to the toilet, and it starts to back up and poison you.
Yeah, it will.
Like, I ended up in hospital during the first lockdown, without getting too gross. Like, if it won't come out one way, shall we say, there's a
It will
job
come out.
come out another way.
It will find a way out. Yes,
And it did. And
your body is built that way. You know,
yeah.
all of our organs inside of us are built or are helping us to detoxify and keep the bad things out. That's why that's a huge part of my story, my story, personal story, with my pancreas. My pancreas and liver just could not handle filtering all of that alcohol anymore, and you know it had enough. But yeah, that's what vomiting and all that is and purging. You're purging the bad out of you. And apologies if this is graphic or anything like that, but it's just something to talk about. Yeah, toxins have to go, like Heavenly said there. Your body will find a way to get the bad out, and that's a pretty phenomenal thing if you think about it.
Yeah.
It's really cool, like scientifically and all that. How your body can, fight against the bad to keep winning. You know.
Did, and that's what happened with me, because I got that backed up, and because nobody was seeing me, I couldn't get any face-to-face appointments or anything. At one point, I looked really heavily pregnant, and because I wasn't getting anyone to see me, I wasn't seeing a doctor, I wasn't going to the hospital, it literally managed to bring it out another way, and it was far from pleasant, and it is as you would expect, but in reverse. And it was horrible, and it was like something out of a horror movie. But the problem is, because it had gone on that long, that was the only way it could come out. And things were starting to shut down. I ended up with like very mild jaundice at one point, because things were just not going as they should. And eventually I ended up going into A&E, being admitted. I was in 2 weeks, put on a drip, because I was so dehydrated and everything, because I couldn't eat anymore, I couldn't drink anymore, and because I wasn't able to get any appointments and things, I was just putting it off till I couldn't anymore. And I've got quite a strong pain threshold, and that was the problem, because I'm used to putting up with it. I was putting up with it till my body was like, no more. And that, with that, and then the passing out and the convulsions and stuff, the blood poisoning,
Yeah,
that's hopefully where it's all going to stop. because it's going to allow my body to run normally as it should, and then eventually they're going to sort out the prolapses and things, which is like a wire mesh that they put inside of you to hold things in place, just to hold it back to where it should. Because what caused those is because my bowel was so like all the intestines and everything was so backed up and so full, the weight of it was just too great for all the organs, and it just got everything from inside and just pulled it down, and now everything has just dropped. So I've got like a multi-organ drop at the lower half.
Yeah.
It does mean, as they've said, there's a very good chance I'll have to have a hysterectomy to make room, but I'll cross that bridge if and when it comes to it. But I'm just trying to think one thing at a time. This was the most important one for me at the moment.
Yeah.
So I thought, right, we'll get this one done, and then I will allow myself to think of the next ones. There is potentially this surgery, and then potentially 2 or 3 other ones that I may have to have. But each one at a time, I will go through it one at a time.
So it's fascinating. I find I find medical things fascinating. I ride an ambulance for a living. It's my thing. But talking about, bringing it all mental health wise, and the one thing that I did want to touch on, actually, before we go any further, is the COVID-19 pandemic. We mentioned it earlier in the show, and how that delayed your surgery. Now, what has this done for you? And I'm sorry if it's going to be kind of backtracking a little bit, but the COVID-19 pandemic hits, right? And you were slated for this surgery for years and years now, 2 years, whatever. What has the COVID-19 pandemic done medically to you now? And then how does that affect your mental health as far as with the medical system? You know what I'm saying?
Yeah.
Does that make
Yeah. So there's no hiding the fact that if COVID hadn't have happened and I'd have had the surgery when I was scheduled to, the multi-organ drop prolapse would not have happened. That has happened as a direct result of COVID, causing the delay with the surgery. That has happened because of it. And the fact that I'd been admitted twice with being septic also as a result. So it has very, very nearly cost me my life because of the fact that it was delayed so drastically. I was scheduled to have this surgery in April of 2020, and obviously COVID, and it just got cancelled straight off. No, like, oh, we'll do something to help. Literally nothing. It has also caused problems with. Now, I can't go into too much detail regarding it, but there have been other problems like blood tests. I have a lump that was discovered back during when I was admitted that has only got bigger and bigger. And I have waited now close to, well over 18 months for a scan for it. So depending on the outcome of that, it could be potentially other things it's caused. But just the drain of having to just keep going, the pain it's caused, the significant weight loss because I can no longer eat, I'm just mentally and physically exhausted. It's cost me a lot in the way of not being able to go out, not being able to do anything with my son because of the pain, the discomfort, the worry that, like, at one point I was having to take so many laxatives just to try and keep going, but that also caused like hernias and other problems. It caused quite a nasty problem with having to use regular enemas and stuff. I ended up perforating something inside. It caused I want to say it's diverticulitis.
Diverticulitis, yes.
Yeah. It caused the perforation inside. It got infected. I've had to have anal steroids. I've had to have steroids orally. It caused up and down with the weight. Again, all because the surgery was put off. So it's a direct result of COVID.
I do like Dude's question here. What are you doing to prepare yourself mentally?
I've certainly been writing a lot down, journaling.
I know we talked about that, Gemma, and I want you to elaborate on this, please, because again, I'm so sorry. Again, journaling. Here it is again, folks.
Mm-hmm.
How many times have we said on this show the word journaling?
I think every episode.
Every episode.
Mm-hmm.
Journaling. So Heavenly Dew posted the question. Let me see if I can find it here.
Yeah, it's up there. Yeah.
What are you doing to prepare yourself mentally? And this is the perfect advertisement for journaling. Mm-hmm. Take it away, Gemma.
Yeah, so I keep a journal daily anyway, just of my, like, a mental health check journal. I try and post one thing every day in that journal, like a gratitude, something that for that day I'm grateful for, even if it's just something small. And then I try and post a little bit about how the day has gone. But with this one leading up to it, I've started doing about anxiety, what thoughts are going through my head. And then I try and put, because I do a digital one, so if there's anything relevant, like a particular song that's helped me get through it, I'll post a little link to that song of something that I've listened to that's helped me get through it. I post about what thoughts are going through my head. And also if there's any questions. I've had to keep a bit of a diary anyway for the doctor, in the way of, like, if I've had any, for example, bowel movements. I know it's gross, but I've had to keep a diary of that. You have to keep a diary of types and stuff. They're very specific with what they want in that sense. So I've kept all that together with it. But things that I've done, like, I will be documenting this, what we've done. This has helped me, because had I not have been on here now, chances are I would have been cooped up in my room by myself, worrying and stressing about it. I know we've spoken quite a bit lately as well, and that's just helped me get through it, just to distract me, because I think there was one day where I wasn't going to speak, but we ended up doing so, and it just got me out of that rut of just feeling totally sorry for myself, and like, oh God, like, I feel like crap, just feeling really sorry for myself laid there. And sometimes you feel like you can't be bothered to do something, and it's just like, when you do it, you're really glad you did.
Mm-hmm.
And if there's ever like a chance with that where you get, I'd say, just do it, just go for it. And I always document about things that we've like that I've done, if I've spoke to you, for example, or if we've done a broadcast, or if I've spoken to anyone, if I've done anything where I've been, just something to make me focus on the positive things of the day. I also document if there's anything bad happened,
Mhm.
but I tend to do that first, get it out of the way,
Absolutely.
and then focus on the good stuff. I always document the bad stuff first, because I like to finish on a high, or finish on a positive, and then right at the end, I'll post my gratitude piece, like something that I'm grateful for in that day or in that moment, linked to a song, linked to something I've maybe watched, so that I can look back and think, oh, that's what I did. Even like a YouTube video or something that's made me laugh, for example, or a TV program I've watched, just something that has given me that enjoyment that day. And it does help. It does help. And even if you can't do a right lot, as I say, it's not something you're handing in. It's not homework. It's not an essay that you have to do.
Yeah.
You can put in as little or as much as you want. Some days all I really manage to do is, because my electronic one's got like smiley faces and you rank your mood. And I do that. And sometimes I just put feel like crap and pretty much leave it at that.
Sometimes that's the case, I scribble in my journal.
Yeah. I've done drawings and stuff in mine, like whatever. I've done all sorts.
I've done all kinds of stuff in my journal, like
Yeah.
writing down what happened that day, writing
Mhm.
down, drawing something, there's even a glued in article, just all kinds of stuff.
Mhm.
It's we can't say enough about it. How many times do we talk about journaling on the Mental Health Hour, Gemma?
It comes up every day, every
Episode.
Mhm.
It's something else. I'm telling you.
Mhm. It really does help, though.
All right. Well, we are getting to that point where it's
Mhm.
the end of the episode. So we're going to wrap things up a little bit. We'll do a little program note. Next week, we'll be back Wednesday. Normal.
Mhm. Yeah.
Oh, same time, same place. Actually,
No, time difference.
the
So it'll
time
be
difference
10,
has, yeah.
10 p.m. UK, because we're
We'll
going
get
to
it
be
figured out and we'll put you in the Discord.
Yeah.
For those of you wanting more information, please join our Discord.
Mhm.
Hattie has been nice enough to post it throughout the show. Appreciate that, Hattie. And Trevor is going to keep us posted on Gemma's Discord as well, with any updates.
Uh-huh.
So please stay positive. Everybody stay positive. That's that's the biggest thing. And yes, of course, for all things bunny,
Yeah,
please
coming up.
check out Ella the Bunny Mom. www.mybunnyvalentine.com. You know you love these little guys. I know Heavenly Dew loves these little guys.
I never remember to bring mine in.
I always have my bunnies around.
I had my pin badge on my jacket, but I've taken it off.
Yep.
My jacket was.
mybunnyvalentine.com. And then no Catalyst tonight, but that is tomorrow night.
Yeah.
Wednesday night, Jim in Chicagoland, Catalyst. Doing his thing with the candle. Love it. You guys, we really appreciate, Gemma and I really love doing this show. And again, please, if you haven't joined the Discord, get active in it and let us know what you want us to talk about. Send us some show ideas. Send us anything you want to hear about. We would love to do a show on anything you come up with. Mental health related. I'm not going to do a show on Super Bowl 47, but maybe if I can tie it into mental health, I'll do it.
I'm pretty sure you can be tied into anything mental health.
Molly's here. I was lurking. It's always good to see Molly. Molly, we gotta get you live up in this sometime. Yes, all things bunny. We love our Ella. And I think, Gemma, we wish you the best tomorrow. Trevor's going to keep us posted. Is there anything anybody can do? Or
I'll be fine. Like, I'll let a few people know. I've got numbers of people.
Okay.
So when they text, you can put it in as well if you want in ours.
Awesome.
It might not make much sense when I message. That's why I don't want to do it public, just in case I end up messing up like I did with the autocorrect earlier. That was a corker, was that one?
Prayers for Thomas as well.
And that's without anesthetic, so goodness knows.
Prayers for Thomas as well. Must be hard seeing mommy not well. Yes. So we will be back next week. Gemma will be here. We'll get a little update and we'll continue on with the mental health hour. We love you guys. Thanks so much for joining us tonight. It's been fun. And we'll keep bringing the mental health content. Join the Discord. Tell us what you want to hear about. We'll do anything for you. All right, guys. We hope you have a blessed evening, and we'll see you guys next week.